You're strapped to a wooden table. London, 1842. No anesthesia exists yet. None. Four large men pin your arms and legs. The surgeon rolls up his sleeves, glances at the clock, and tells you to hold still. Your leg is coming off, and you'll feel all of it. This is how surgery worked for almost all of human history. Here's what really happened on those tables back then, and why your body still panics at the sight of a needle today. The fear you feel in a waiting room right now, it got built over thousands of years of surgery meaning pure agony. So let's go back and watch how they actually did it, and how they kept anyone alive through it.
Go back to ancient Egypt, around 3000 BC. Healers were already cutting into bodies. They drained abscesses, set bones, stitched wounds shut with copper needles and linen thread. For pain, they had almost nothing. A little wine, maybe a paste of herbs, a hard bite down on a strip of leather. Sounds simple. It wasn't. Every cut was a race against a screaming patient. Now think about the last time you got a filling at the dentist. Your jaw's numb, you're scrolling your phone, mildly annoyed the visit ran long. That numbness is the whole miracle. Take it away, and you're back in that Egyptian healer's room, gripping the table, counting seconds. Same procedure, same nerves firing. The only thing that changed is that today, we turned the volume down.
Go back even further. Neolithic times, over 7,000 years ago. People were drilling holes into living human skulls. We found hundreds of them, holes scraped clean through the bone, probably for headaches, seizures, or evil spirits. Here's the strange part. The bone around the holes had healed, which means the patients lived. Someone drilled into a conscious person's head with a sharp rock, and they walked away. And brain surgery still opens the skull today. We just call it a craniotomy, and you're deep under. Same basic act. Get through the bone to reach the brain. Now there's imaging, precision saws, a whole team keeping you alive to the millimeter. Back then, it was a rock, a steady hand, and raw luck. The idea was right by 5000 BC. The survival part took another 7,000 years. In ancient India, around 600 BC, a surgeon named Sushruta was rebuilding noses. No joke, reconstructive surgery that long ago. People lost noses to punishment or war, so he'd cut a flap of skin from the forehead and shape a new one. For pain, he got patients drunk on wine before the knife came out. That was the anesthesia. Alcohol and a lot of prayer. These days, a plastic surgeon does the exact same forehead flap technique. The method still carries his name. But now you're asleep, monitored, breathing through a machine. You wake up sore and confused, not traumatized. Back then, the patient watched, felt the blade lift the skin, stayed awake for the whole thing, knuckles white. The technique survived almost unchanged across 2,600 years. The suffering didn't have to. Here's the detail that changes everything about old surgery. Speed was mercy. If you couldn't kill the pain, you shortened it. So the best surgeons weren't the most careful ones. They were the fastest. In Victorian London, an amputation got timed like a sport. Take a leg off in under a minute, and you were a legend. And this is where it gets dark. There was a surgeon named Robert Liston, London, 1840s. Fastest knife in the city, a leg off in under 30 seconds. Crowds packed the operating theater just to watch him work. One time he moved so fast, he took off the patient's leg, 2 of his assistant's fingers, and slashed a spectator's coat. The patient and the assistant both died of infection. The spectator died of fright. 3 deaths from one operation. That was a rough day, not a scandal. Now compare that to today, where a surgeon spends 6 hours on a single knee and nobody's rushing anyone. We slowed surgery down because we finally could. When the patient's asleep, the clock stops being the enemy. Speed used to be the only painkiller anyone had. Turns out, precision was a luxury of comfort. Notice something? That old terror of the knife never disappeared. It just moved. You feel it when the nurse says small pinch. You feel it the night before a procedure, low in your stomach. That's not weakness. That's thousands of years of your ancestors learning, correctly, that being cut open meant unbearable pain. Your nervous system never got the memo that we fixed it. It still braces for 1842.
So how'd anyone survive without infection control? Short answer, a lot didn't. In the 1800s, surgeons wore the same blood-crusted coat for years, like a badge of experience. They didn't wash their hands between patients. They'd go straight from a corpse to a childbirth without a thought. The knife that cut you had cut 10 people before. Germs weren't even a concept yet. Today, an operating room is scrubbed, sealed, and colder than your fridge, on purpose. Everyone masks up, gloves up, sterilizes everything twice. It feels like overkill until you realize what it replaced. A world where the surgery went fine and the infection killed you 3 days later. We didn't just invent anesthesia. We hunted down the invisible thing that was quietly killing everyone who survived the blade.
Then there's how they stopped the bleeding. No clamps, no stitches fast enough, so they used fire. A hot iron pressed straight onto the open wound to burn it shut. In battlefield surgery for centuries, after an amputation, they'd sear the stump with a glowing blade or boiling oil. Patients said the burn was worse than the cut. But it stopped the bleeding. Alive beat comfortable, every time. Today, a surgeon stops bleeding with an electrocautery pen that seals vessels in a little puff of smoke, and you're asleep, feeling none of it. Same principle exactly. Heat closing a wound, minus the screaming. That faint smell in a modern OR, it's the great-great-grandchild of the battlefield hot iron. We didn't throw the old idea out. We just wrapped it in enough comfort that you never notice.
And here's what people get wrong about the past. We picture old surgery as pure butchery. Sawing, screaming, filth. A lot of it was. But those surgeons weren't stupid or careless. They were brilliant people fighting with both hands tied. No pain relief, no germ theory, no antibiotics. And they still saved lives with nothing but nerve, speed, and steady hands. Working half-blind, basically. Here's the part nobody notices. We didn't get braver than them. We got more equipped. Strip away your anesthesia, your antibiotics, your sterile room, and you'd be right back on that wooden table, biting leather, praying it's quick. The gap between then and now isn't courage. It's chemistry and knowledge. They had the far harder job, and most of them will never get any credit for it.
Want to know what they used before real anesthesia? A grab bag of desperate tricks. In medieval Europe, they had dwal, a knockout drink of wine, hemlock, opium, and pig bile. Trouble was, get the dose slightly wrong, and it didn't dull the pain. It stopped your heart. In ancient China, doctors used cannabis. Some cultures just knocked patients cold with a blow to the head. Now, an anesthesiologist calculates your exact dose down to your body weight, watches a screen track every breath, and adjusts in real time. That whole profession exists to do one thing: keep you in the narrow gap between feels nothing and never wakes up. Back then, that gap was a guess with pig bile. Today, it's a science with alarms. Same tightrope. We just finally strung a net under it.
Right before ether, people got desperate enough to try anything. In the 1830s and 40s, some doctors tried hypnotizing patients. Mesmerism, they called it. Swing a hand, drop your voice, convince the mind it felt nothing. A few surgeries reportedly worked that way. Most didn't. It was a shot in the dark by people who knew there had to be a better way than holding someone down. Then comes the day everything flips. October 1846, Boston. A dentist named William Morton puts a patient under with ether gas and removes a tumor from his neck. The man feels nothing, wakes up and says so.
The room of surgeons goes dead silent. For the first time in human history, someone was cut open and did not suffer. One of them muttered, "Gentlemen, this is no humbug."
Sit with how big that is. Every human before that day, every soldier, every mother, every child who ever went under a knife felt all of it. Millions of people, thousands of years, one long scream. And then one morning in 1846, that just ended. The single biggest drop in human suffering there's ever been. And most people today have no idea it even happened. That's the wild thing about right now. You walk into a hospital today fully expecting not to feel your own surgery. That expectation would have sounded insane to every person who lived before 1846. Painless surgery was a fantasy, like flying. Now it's the boring default, the thing you'd sue over if it failed. We inherited a miracle and turned it into fine print on a consent form.
But here's where it gets weird. Even after ether, the dying didn't stop. Civil War, 1860s. Surgeons finally had anesthesia, so amputations were painless. Great, except they still didn't clean their instruments. So the soldier slept through the saw and then died of gangrene in a filthy tent a week later. Half the deaths weren't from the wound. They were from the care itself. Compare that to now, where a soldier hit in the field gets clotting agents, a medevac, and a sterile trauma bay within the hour. We didn't win by inventing one magic thing. We stacked wins: pain, infection, blood loss, shock, 1 century at a time. Old surgery beat the pain and lost you to the germ. Modern surgery had to beat every enemy at once to keep you breathing.
Ever wonder where bite the bullet comes from? Battlefield surgery. No anesthesia, so they'd hand a wounded soldier a lead bullet or a leather strap to clamp his teeth on while they cut. Gave him something to do with the pain besides scream. And your barber? In medieval Europe, the barber also did surgery, pulled teeth, took off limbs. That red and white pole meant blood and bandages. You still say bite the bullet today when you brace for something rough. A hard meeting, a bill, a breakup. You have no clue you're quoting a battlefield surgeon. That's how deep this runs. The pain's long gone, but the language stayed, buried in how you talk. Every time those words leave your mouth, you're echoing a soldier on a table, jaw clenched, waiting for the blade to drop.
There's one more thing about the awake era that'll stick with you. Patients remembered. A woman named Frances Burney had a breast tumor removed in 1811, fully conscious. She wrote it down after, described feeling the blade scrape the bone, said she screamed the whole time and could still hear herself years later. That letter survives. It's one of the only first-hand accounts of what surgery actually felt like. Read her words today, and your whole body tenses up. That's the point. You're wincing at something she lived through wide awake. And that flinch, that instinctive, no, not that, is the exact same signal that kept your ancestors clear of danger. Sound familiar? It's the same thing that makes you look away from a needle now. Old pain, still wired into a modern nervous system.
Think about what surgery actually asks of you today. You lie down, a stranger puts you to sleep, and you trust them to open your body and close it back up. That kind of trust is brand new in human terms. For most of history, surgery meant you'd be awake, held down, and maybe betrayed by the very care meant to save you. We forget how much faith that table quietly demands. And back in those centuries, people didn't even expect relief. Pain wasn't a problem to solve, it was just the price of staying alive. A farmer in 1700s Europe with a rotting tooth had two choices: live with the agony, or let someone rip it out with iron pliers, no numbing, in a market square. He'd pick the pliers and call it a good day. That was medicine. Now, you take an ibuprofen because your shoulder's a little stiff. And honestly, good, you should. But it's worth remembering that comfortable is the historical weird one, not the tough ancestor. Every painless thing you take for granted today was somebody's impossible dream a few generations back. The numbness, the clean room, the sleep, all of it was science fiction to the people who built your tools. If you're into this kind of then and now breakdown, digging up how people actually lived and why you still feel it in your gut today, subscribe. There's a whole hidden history behind the stuff you do without thinking twice, and most of it explains more about you than you'd expect. Stick around, because the next one gets under your skin too.
So here's where we land. For almost all of human history, getting cut open meant being awake for it, held down, racing a clock, and hoping the infection didn't finish what the knife started. Then, in one Boston morning in 1846, we quietly ended the oldest kind of suffering there is. And we've been stacking wins on top of it ever since. Pain, germs, blood, all of it. Those surgeons weren't braver than us. They just had nothing and did it anyway. We got everything handed to us and call a filling an inconvenience. So next time a doctor says, this might pinch a little, and you feel that old dread rise up, that's not you being dramatic. That's every ancestor who felt the whole thing telling you that you got lucky. For the first time ever, you did.